The story dominating the news this morning, shock as King Charles reveals he's been diagnosed with cancer.
The news came after successful treatment for an enlarged prostate, during which a Buckingham Palace source revealed a separate issue of concern was noted by surgeons.
The King will now begin a schedule of treatment and continue to undertake official paperwork, although his doctors have advised him to cancel public duties.
Well, Buckingham Palace has said the King's feeling wholly positive about his treatment.
Meanwhile, the Duke of Sussex has spoken with the King and will travel home to see him in the coming days.
Well, joining us now with all the latest is our royal correspondent Cameron Walker, who joins us from Buckingham Palace. Good morning to you, Cameron. This is turning into something of an annus horribilis for the royal family, isn't it?
Yeah, it certainly is, Isabel. The King has not been on the throne that long, and we have now had a number of health scares with various members of the royal family. But of course, the King is our head of state, and the fact that he has been diagnosed with what Buckingham Palace describe as a form of cancer really has come as a shock. And you just see it with the tributes pouring in across the globe. It is understood that it is not prostate cancer, and this separate issue was discovered when the King was in hospital a few weeks ago receiving treatment for an enlarged prostate, which Buckingham Palace said was benign. The King's being treated as an outpatient in hospital, and he started his treatment yesterday, but he is going to not be spending any nights in hospital at this stage. He is spending the night at Clarence House. He travelled back from Sandringham yesterday morning. The last time he was seen in public was that Sandringham walk to the church with the Queen on Sunday morning. But in other news, which perhaps emphasises the seriousness of the situation, is that the Duke of Sussex, a source close to the Duke of Sussex, has said not only has he spoken to His Majesty about the diagnosis, but he's also making plans to fly very shortly across the Atlantic to London to spend time with his father. Of course, they've not been on the best of terms in recent years, and I think this highlights perhaps that the King and the Duke of Sussex want to perhaps have some kind of reconciliation and indeed spend time with each other following this diagnosis. As for Prince William, the Prince of Wales, I'm told he is always, as you would expect, in regular contact with the King, and the King personally told Prince William ahead of the announcement at 6 o'clock by Buckingham Palace last night. I'm told the King can still carry on with constitutional duties, so although we're not going to be seeing him in public, he's still going to be going through his red boxes, signing government papers, reading cabinet minutes. He's also going to be taking part in Privy Council meetings and having his weekly audience with the Prime Minister. But of course, if doctors' advice changes and perhaps he can't do it in public, perhaps provisions will be made for the King to do that virtually. Buckingham Palace are really keen that we don't speculate as to the exact diagnosis. We know it's a form of cancer and we know it's not prostate cancer, but beyond that, they really don't want us to speculate. It's a really tricky balance for the palace, because on the one hand, the King is a private individual. He has a right to private medical information. But at the same time, he's our head of state, and the public do have a right to know about the health of our monarch. Other members of the royal family are continuing with their public duties, we're told. But of course, we're not going to be seeing the King in public for some time. But Buckingham Palace said last night that the King remains positive about the treatments he's receiving and looks forward to returning to public duties as soon as possible.
Cameron, thank you very much indeed.